Do you know the use for earwax? There's actually a use. Earwax is actually an insect repellent. How many times have we seen holes in trees and there's some spiders in there? If we did not have earwax, we would have spiders living in our ears. I've never seen a spider in any child's ears, but I've seen a cockroach in one lady's ear. She was an adult and she had cleaned out her earwax and she had absolutely zero earwax, and there was a cockroach in her ear. Hello, my name is Dr. Sanusi, and thank you for joining the program today. Today we're going to be talking about earwax, and the reason it's important is because we have a lot of questions from families that how important is it to clean out the ears because they are dealing with earwax with the children. Now, we usually recommend that if you're going to clean your child's ear, you want to clean the outside. And the reason is the eardrum is actually a little distance from the outer ear, and the eardrum, you don't want to perforate it by cleaning or going too deep. So you don't want to clean your child's eardrum generally because earwax by itself, it comes out eventually. If you leave your child's earwax, you think that you see a lot of earwax in your child's ears. If you leave it long enough, it's going to come out, and what we recommend is clean the outside and allow the wax to come out because there's hair cells in the external ear that pushes the earwax out. So any wax you see in your child, if you can't see it, just clean it with your fingertip. Put a little washcloth on your fingertip and clean the outside. You don't want to use Q-tips on the inside, and you don't want to perforate your child's eardrum. Now, if you see a lot of earwax in your child's ears and your child is fine playing, there's really no reason to get it out. If your child is complaining about pain in the ears, follow up with your doctor. The doctor will actually use, sometimes we use Ekuase, which is a stool softener, to soften the wax, let it sit for a few minutes, and then we use the air irrigation, which is like water, and we just spray it into the earwax, and that actually helps to wash out the ear canal. Do you know the use for earwax? There's actually a use. Earwax is actually an insect repellent. How many times have we seen holes in trees and there's some spiders in there? If we did not have earwax, we would have spiders living in our ears. I've never seen a spider in any child's ears, but I've seen a cockroach in one lady's ear, and she was an adult, and she had cleaned out her earwax and she had absolutely zero earwax, and there was a cockroach in her ear. That's the only thing that I've actually seen, the only time I've seen an insect in someone's ear. So earwax is protective, it's an insect repellent, it actually has immune uses to keep the eardrum nice and clean and to keep it sanitized. So please, please, please don't put hot water in your child's ears because that hot water can perforate the eardrum. The eardrum has to do with hearing. There's small bones, the smallest bones in the body, the malleus, incus, and stapes, they're in the ears. And you could cause deafness in your child just by trying to clean earwax from the ears. So it's absolutely not necessary. If your child is having ear pain, see your doctor. We can actually go in there and clean out the wax because we know what distance to use based on the fact that we can see the eardrum, we can see the wax. And if we can't see the eardrum and we have to get the wax out, we can take it out with the little kits that we have for earwax removal. Cotton buds can help to clean the nose. If your child has mucus in the nose, you can put some Vaseline on the cotton bud and clean the nose. It can clean the, everybody has like little crevices in their ears. You clean the outside of the ears and you just clean just the entrance of your ear canal. That's the external ear. You don't need to put it inside your child's ear to clean out wax. It's absolutely not necessary. So I just want to encourage our moms that please, 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 you see wax, clean with your fingertip and a washcloth, just clean the outside. You don't need to go in, you don't need the Q-tips. You don't want to perforate your child's eardrum. You don't want the child to be deaf because of earwax. And if the child seems like they're having some issues with their ears, follow up with the doctor. The doctor can tell if there's an ear infection that might need to be treated, and that will require oral antibiotics, not ear wax removal. Now, when you pierce your ears, remember it's the external ear, it's the earlobe, and it doesn't affect the inside of the ear. It doesn't affect hearing. Some people, when they pierce their ears, they might have a reaction to the earring that was placed, especially if they have allergies. So they might end up having eczema or just delayed healing because they use non-gold posts. If you have a family history of asthma or allergy, then you want to pierce your ears, your child's ears with gold hypoallergenic. Gold is actually hypoallergenic or hypoallergenic earrings so that they don't react to it. Some people might end up having keloids from ear piercing because that's the genetics of their family, and they end up having big skin tags from hypertrophic scarring, and that can look quite ugly, and then they have to need they might need to have that surgery to take off the keloids, which is like an extra ear just hanging from the part where they had the ear piercing, but it doesn't affect the eardrum itself because the eardrum is up here and the earlobe is down here, so there are two different parts of the ears. There's no side effects of having earwax in your ears, no. If you have a lot and it's pierced, it's touching your eardrum, it can cause pain, but there's really no reason to take out the earwax, absolutely not. Some people are not, guess what, earwax is genetic. When I look inside an Asian American child's ear, it's more grainy. When I look inside, different races of people have different types of earwax. And it's amazing that you can look in an ear and kind of like figure out that, okay, the ethnicity of the child. So it's genetic. If your family produces a lot of earwax, then you will produce a lot of earwax most times. And a lot of families, they say, oh, we have wax in our ears, and everybody knows and laughs, and that's it. But there's really no reason to take out the earwax because it's protective. It's protecting your child's eardrum from bugs, and there's some immune function for earwax too. So there's absolutely no reason to take it out. I hope this has been informative on earwax removal. You don't actually have to remove your child's earwax, and if you think your child has a problem with hearing, sometimes seeing the doctor and having them wash the ears out is actually a better alternative than trying to remove so much earwax and end up perforating your child's eardrum. Until next time, I want to say thank you for joining us. Thank you for your time. And if you want to send us questions so that we can answer on any of our shows, we'll be happy to do so. Please look at the links and subscribe to our channel so you can always get up-to-date, accurate information about your child's health. Thank you so much, and see you next time. Bye-bye.